Today I'd like to talk to you about the macrovascular, cardiovascular complications of diabetes. Now, when we talk about diabetes, we often talk about and think about blood sugar levels and insulin resistance and insulin deficiency. But we forget about the other complications, and which is why I think it's important we discuss the macrovascular complications today. So macro means large, vascular is blood vessels, so large blood vessel complications of diabetes.
Okay, so if there are large blood vessel complications, doesn't that mean there's small blood vessel complications as well?
Yes, you're right. So the small blood vessel complications of diabetes are diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. Retinopathy affects the eyes, nephropathy affects the kidneys, and neuropathy affects the nervous system. So they are the microvascular complications. We could talk about microvascular complications at a future visit, but today let's just focus on macrovascular complications. There are two major macrovascular complications of diabetes. One is a stroke, and the other is cardiovascular disease, heart attacks. Strokes, if you're diabetic, you're twice as likely to suffer a stroke. And if you're diabetic, you're 5 times more likely to suffer a heart attack than a non-diabetic, which is why it's important that we sort of address this issue. The main cause is down to atherosclerosis, which is what leads to the heart attacks and strokes.
Okay, so what is atherosclerosis?
Atherosclerosis is the narrowing of the blood vessels, and there are several factors that contribute to the narrowing of the blood vessel. The inside lining, the endothelium of the blood vessel, can be damaged through high blood pressure, high blood sugar, or smoking, the chemicals in cigarettes. So once the inside of the lining is damaged, then fat globules, fat cells in the form of foam cells, will lodge onto the damaged inside lining of the blood vessel. And over a period of time, they will accumulate and form an atherosclerotic plaque and narrow and reduce the blood flow, and in some instances even block the blood flow completely. So when the blood flow to a tissue is reduced or blocked, then it causes tissue damage.
Okay. So is that why everyone always says that heart disease and diabetes are linked? You get damage to your heart.
Yes, when the blood supply to the brain is blocked, we call it a stroke. And similarly, when the blood supply to the heart is blocked or reduced, and there's tissue damage, we call it a heart attack or a myocardial infarction or an MI.
Okay, so what can I do to reduce this atherosclerosis or get rid of it, and how can I avoid having a heart attack?
Okay. Now you can reduce the risk of suffering a heart attack by several lifestyle modifications, like changes to your lifestyle as well as medication. So in terms of, to start with, I think exercise, people need to be more physically active and exercise more on a regular basis. You should start eating a healthy diet that would sort of help reduce the blood, help reduce your weight. So if someone is overweight, then that needs to be addressed. Smoking, if you're a smoker, you need to give up smoking. So that's weight reduction, increased exercise, quitting smoking, maintaining a good blood pressure. So if you're hypertensive, if GP has told you you've got a high blood pressure, be addressed with medication to make sure you maintain a regular, appropriate blood pressure. Your blood sugar as well. Ideally, we would recommend a pre-meal blood sugar of between 4 and 6 millimoles, and post-meal blood sugar of about 10 millimoles. So you need to try and aim to maintain those blood sugar levels. And finally, your cholesterol, reducing your cholesterol or maintaining a low body fat or body cholesterol. There are lots of subgroups as low density lipoprotein, high density lipoprotein, triglycerides, but they all, as a whole, we look at the cholesterol and we need to try and reduce our cholesterol and keep it low. So yes, those are the different ways you can address or reduce your risk of developing heart cardiovascular complications.
Okay, but who does heart disease normally affect?
Heart disease can affect any of us. And normally it's a disease of where it is believed, people assume that you get it with age as you grow older or in middle age. But atherosclerosis commences in a younger age, and heart disease can affect anyone from 30 years onwards. So as young as 30, effectively. Yeah. So it's important that it's addressed early.
Okay.
Okay. Thank you, Caroline. All the best.
Thank you.